Welcome, Dr. Jenn, to the Biohacker Babes. Thank you so, so much for joining us today.
Thank you for having me. I'm so excited to be here.
We're really excited to bring this topic to our audience, and potentially it could be a confronting one, but an empowered one. We really feel like this is so important to share. You were on the front lines as a breast surgeon for a long, long time. I'm not sure how many years in total before you turned a corner.
Till I went to the dark side.
Till you went to the dark side. But you yourself, you have some breast cancer in your family. You were diagnosed, and I believe there was a big turning point. I'm just curious to kick this off with, like, what did that feel like to realize that the path that you were on was maybe something different that you were then being called to take?
Yeah. I mean, in retrospect, of course, it's all crystal clear and that we all have a path that we're supposed to walk. And I will forever be grateful for the path that I took, because I could never be this version of me without having experienced and endured everything that I had. I come from a breast cancer family, as you clearly stated. I come from a very big family, and every woman in my family got breast cancer with the exception of my mother, who had colon, and me, who had thyroid. So growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. I'm much, much older than you ladies. And she wrote 54 hits in all, but her most famous song was the iconic hit from Whitney Houston called The Greatest Love of All. So she didn't write that song for Whitney. She wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But when Whitney Houston released that song in March of 1986, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know, because she died of metastatic breast cancer 1 month after Whitney released that song. She was 37 years old. I was 16 years old, and my hero died. Still can't tell this story. Her life and ultimately her death gave birth to my life's purpose. And I did the only thing I knew how to do, because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And so I became a doctor, the first doctor in my family. I became a surgeon. I became the first fellowship-trained breast surgeon in Philadelphia, the first oncoplastic surgeon in Pennsylvania. And I did that really well and for a really long time. And I did it long enough for my aunt to be diagnosed and long enough for my mother to be diagnosed. And then at the age of 46, it was my turn to sit in that chair across from my friend and colleague and physician and have to hear that you need surgery and radiation and chemotherapy, and you're going to be on lifelong medication. And for someone who sat in that opposite seat for the previous 20 years and said all day, every day, these words to women, somehow when they're coming at you, they land differently. And despite the fact that I was a conventionally trained physician running a conventional cancer program, and I did not know of anything else. But all I could hear in that time and space was a voice in my head, and you can call it God, and you can call it universe, and you can call it batshit crazy. But I heard, there's something more, go find it.
Wow.
And so I went on a journey. And this journey wasn't about making the world a better place. It wasn't about healing my patients. It wasn't about finding alternatives. It was this calling that I had that told me there's something more, go find it. And so in very short order, I find myself sitting in a lecture hall, and this tall, lanky guy walks on the stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, despite the fact that I'm sick, I am still a conventional doctor, a surgeon, super, super cynical, my snooty booty self, a doctor for 20 years at this point, and all I can think of is, there's no such thing as a functional medicine physician. What is this quack talking about?
And what year was that?
This was 2016.
Okay.
Okay. So it turns out that the quack is Dr. Mark Hyman. And I can't imagine a scenario in this day and age where you wouldn't know who Dr. Mark Hyman is. But you can easily imagine a scenario in 2016 where you had no idea who Dr. Mark Hyman was. And I was in that boat. But I did know that I was sick and there for a reason. And so I checked that big fat ego at the door and I tune in, and thank God I did. Because what Dr. Hyman would have to say over the next 2 hours would not only show me how I was going to heal myself, but it also completely pulled back the curtain on everything that is wrong with our current medical system and the role that I was playing in it was not what I was meant to be doing. Because as a surgeon, in our conventional medical system, we focus on symptoms and symptom suppression, right? And we think that the symptom is the problem. And in the world of cancer, we think the tumor is the problem. The tumor is not the problem. The tumor is the symptom of the problem. And the problem is what needs to be addressed and corrected. But as a surgeon, if you're taking someone to the operating room for cancer and cutting out the tumor, yes, you may be delaying the progression. You may alleviate some of the burden on the body, but you're not changing the trajectory of that person's health. Not at all. In fact, you're probably just delaying the onset of either a recurrence or the next manifestation of illness. Because as we very well know, inflammation can manifest in many ways. And if you don't stop the inflammation, it will continue to manifest. And it's just this never-ending game of whack-a-mole. And so I am an early adopter. I get very, very excited about things. I'm a quick start. So that day I enrolled in the Institute for Functional Medicine. And I spent the next 3 years just immersed in the study of functional medicine. And I came out on the other side and knew that I was put on this earth for a very different mission than being a surgeon. And I'm grateful for my time as a surgeon. My time as a surgeon is priceless and a privilege beyond what humans really shouldn't know. And I had the opportunity to sit with people and literally hold their lives in my hand. It's the ultimate trust where someone goes to sleep and is helpless before you, and you have uncontrolled opportunity to do whatever you're going to do to their body. And it was an enormous, enormous privilege. And I loved every minute of it. But ultimately, I knew that that wasn't enough. And it was never going to be enough. No matter how good a surgeon I was, that was never going to be enough. And I was only ever going to help thousands and not millions. And was I really helping them? I don't know. I believed I was at the time, but in retrospect, was I really helping them? I don't know. And so in 2019, I walked away from surgery and started Real Health MD, which is a functional medicine oasis for women with a history or anywhere on the breast cancer spectrum to help them to restore their health and get the health that they want and deserve. And it also is a constant evolution, because like we never know everything. And what we were talking about before we even started today is that you have to maintain curiosity, because if you think you know everything, then the only fool is you, right?
Right.
And so my curiosity led me to a lot more questions like the ones that you're asking, questions like the ones that your audience is asking, and questions like the ones that have come up, especially recently. If we're doing that wrong, and we've been told for decades that it's the right thing to do, and now we know that it's wrong, what else are we doing wrong? And one of the big things that came up for me is how we're screening for breast cancer.
Yeah. I definitely want to
It's
get
a very
into
long-winded answer to your opening question.
that was wonderful. Yeah, we're gonna definitely dive into the screening process and options, but I first want to thank you for sharing that and for having the courage to continue on and continue asking questions, because I think that can be scary when you've been doing something, one way for so long, to follow that intuition of there's something else. I think is just amazing. And I'm curious
it's especially scary because it meant leaving my tribe. And as we know from an evolutionary standpoint, that is our safety, right? Like anyone who left the tribe died. Right? We can't exist in isolation. So more than anything else, because when I left surgery for functional medicine, what do you think happened to all of my surgical colleagues, my medical oncology colleagues, my radiation oncology colleagues, my radiology colleagues? Like, they all think that I either lost my mind, lost my skills, maybe both. Right?
Sure.
And it has taken some time, but they are now at least accepting what I'm doing. Some of them are recommending me to patients, which is, that's the most beautiful part. But it's very hard to enact change. And that's because it evokes a tremendous amount of fear in people. Again, it goes back to leaving the tribe, being alone, and we all seek safety. That's what humans revel in, safety and comfort. And so in order to get people to change, the pain of changing, the pain of staying the same has to exceed that perceived pain of changing. And that's a lot, right? You really, really, really have to hit your pain threshold before you're willing to take a leap of faith and change. And for most people operating in the current system, like the thought of abandoning everything that they believed to be true for the last 10, 20, 30, 40, 50 years, depending on how long you've been practicing medicine, you can imagine how hard that is. You can imagine for a radiologist to acknowledge that mammogram is not the right way to screen for breast cancer. That takes a lot, because they at the same time have to acknowledge that what they've been doing for 5, 10, 20, 30, 40, 50 years is the wrong thing. Right? That's a very hard pill to swallow, no pun intended.
Yeah, as Renee said, it takes a lot of courage and bravery, and I'm sure there's some shame that comes up, and then it's like one aspect of reality is broken down, so it's like, are all other aspects of reality going to be broken down? That is scary, very scary.
But I think we're seeing a lot of this unfold, not in the mammogram industry. Like, they're still holding tight to that. But I think we're going to see some progress with vaccines.
Yeah.
And I think of our dad. He actually transitioned into being a biological dentist in the mid 80s. So very similar story of like his colleagues turned on him, fellow
I was
students
afraid
at
of where
dental
that
school.
sentence was going, but I'm glad it ended at biological dentist.
In the mid 80s especially.
Yeah.
Yeah, but he kind of, now he can joke as biological dentistry is starting to really shine and becoming a little bit more of the norm. But he jokes that he still has the arrows in his back.
I mean, I agree with the shine, but is it
Our
becoming
world.
the norm?
In our world.
Our
Yeah.
world, but
Our
also I think we'll now, with RFK, people are now aware of fluoride being toxic. The ADA is getting rid of mercury amalgam filling. So, I mean, there's progress. It's
Yeah,
definitely
but it's
slow.
still slow to change.
Yes,
Still very slow to change. And even most dentists don't know anything about biological dentistry.
for sure. For sure. They're going to stop using silver fillings because they're no longer available, not because they chose to.
That's exactly right.
But
So,
yeah.
and I think the fact that dentistry was broken out of medical school, I think that's another sin, right? Like, why is the mouth any different? Why isn't it just a subspecialty of medicine? It should be.
Right.
Cut off the head. It doesn't make any sense.
It doesn't make any sense, right? Like, suddenly the
Yeah.
teeth and the mouth and the gums are not part of our body. They're
System
not
of
part of
system?
our health. They're not part of our wellness. It's like, take them out and put them on the nightstand like my grandma Jenny used to do. I mean, like, of course it's one thing. And I think that dentists need to be as knowledgeable about health and physiology and biology as doctors need to be knowledgeable about what happens in the mouth, and to pretend that they're somehow disconnected is irresponsible at best. At best.
Right. Yeah, our dad says oral health is health, and I've heard you say breast health is health. It's like it's all connected.
It's all
connected.
It's all connected.
Yeah. Yeah. So when you heard Dr. Mark Hyman speak, I'm curious, was there something in particular he said that kind of turned the light bulb on?
Oh my God. I mean, literally within 15 seconds of him talking, I was like, oh my God.
Wow.
Wow.
I mean, you can start with the basic. We spend more money than any other country in the world on healthcare, with almost the worst outcomes, right? So when you start with that and sit with that, when you learn that one in two children are overweight, and that when you learn that we are seeing diseases in childhood that we never saw before. We didn't see, when I went to medical school, not that it was so long ago, kind of long ago, but we didn't have children with coronary artery disease. We didn't have children with strokes. We didn't have children with diabetes, with the exception of the autoimmune juvenile diabetes. But we didn't see children with type 2 diabetes. We didn't see the obesity crisis. We just didn't see children with fatty liver and metabolic disease. We didn't see it. And yet, it's commonplace now. It's crazy when pediatricians don't see it now. And yet, these pediatricians, they're not trained in how to handle metabolic disease because it didn't exist. Right? They were trained in runny noses and rashes. They were not trained in metabolic disease because they didn't have to be. I remember it was, not that long ago, maybe 2 years ago, my pediatrician gave my son a prescription for blood work. And I added some things to it, right? So I added like a full lipid panel, not just cholesterol and HDL and LDL, but I wanted the LDL particles. I ordered an advanced lipid panel, and I ordered a high sensitivity C-reactive protein, a vitamin D. I forget what else I ordered. And she said, to me, well, I asked for labs. And I said, the labs are in there. And she starts to look down the list and she's like, this is not what I ordered. And I said, well, everything you ordered is in there. And then I added some stuff. And she said, I don't even know what any of this means. And I'm like, yeah, that's the problem. Wow. She's like, I can't give you an interpretation of this. I was like, do you remember that the initials after my name are the same initials that are after your name? Like, I don't need you to interpret it, lady. Take your total cholesterol and your LDL and HDL and go your merry way.
Yeah.
Oh
it's
my
like
gosh.
mind-blowing, but
Truly.
in a way you can't blame them because they're not trained to deal with the realities of now.
Yeah. When I send labs to clients, they're accepting, but when I send lab recommendations to friends and they take it to their doctor, I'm like, just so you know, your doctor is going to say that this is quackery, that there's no reason. I'm like, I expect that, of course, because we don't know about metabolic health. And I think a lot of people just think that's like a hip to waist ratio or it's like obesity, but it's so much deeper than
if
that.
they even know that, right?
If they even know that. How would you explain metabolic health to the average person that is just so blinded to this overall picture of systemic health?
So, and I actually think that if we screened for metabolic health with the same intensity that we screen for all the other things, like elevated cholesterol or blood pressure or thyroid cancer or breast cancer or pancreatic cancer, if we instead just screened for metabolic health, we would all be a lot better off. A lot better off. And we would prevent the majority of chronic disease. So if you are metabolically healthy, it means that you are of normal weight, but normal weight distribution in that you can be of normal weight and still be over fat. So metabolic health requires that you have the right ratio of muscle to fat and that your blood glucose is optimal and all of the hormones that are associated with it are optimized too, like insulin and insulin-like growth factor. Now, it's a lot easier to know when you're not metabolically healthy than when you are. And the things that we look at to determine whether or not you are metabolically healthy is we look at the amount of visceral fat that you have, right? That fat that is around your organs inside of your abdomen. So not what sits below your skin, but what actually sits on the inside of your abdomen. Because that fat is very different from a behavioral standpoint than the fat that sits right underneath your skin. The fat that sits right underneath your skin is not very active, but the fat that is inside of your abdominal cavity secretes things called lipokines, and these lipokines are highly, highly, highly inflammatory. It's a protective mechanism. The fat is trying to insulate your organs from the toxicity. And the toxicity is either chemical toxicity, it's too much sugar in your blood because that is very damaging to your organs. It's there as a protective mechanism, but at the same time, it's not healthy. It's bad for you, right? And so we look at waist circumference, we look at waist to hip ratio, but we look at blood pressure. We look at your triglycerides, which are an indication of how your liver is handling the sugar load in your body. We look at HDL, which is quote unquote the good cholesterol. And this is the cholesterol molecule that is going around the body and collecting all the damaged cholesterol. It's like your garbage trucks, for lack of a better word. So, we're looking at all of these factors and we're looking for optimal or ideal. And as it turns out, only about 10% of the population is optimized in their metabolic health. And that's really bad.
It's very sad.
That's significant.
Metabolic disease is not only a predictor of diabetes, of heart disease, of stroke, it's also a predictor of breast cancer, of prostate cancer, of colon cancer. And it's not only a predictor of whether or not you will get those diseases, but how severe those diseases will be and the likelihood that you're going to die of those diseases. Because the more metabolic dysfunction there is, the more likely you are to get and die of one of those diseases. And in the world of breast cancer, metabolic dysfunction is both predictive of getting breast cancer and recurrence of breast cancer, metastasis of breast cancer. So there are some things in this life that you cannot control, but your metabolic health is not one of them. Your metabolic health is within your control, but if you're ignoring the signs, you're not going to control it. Mm-hmm. And what we need to do is have so much more awareness around metabolic health, because what you don't know, you won't fix, right? And if you know that you have metabolic dysfunction, I hope you will make a better decision. But it's very silent for many people. And so you don't even know to make the right decision. And that's where I think that we need to concentrate our efforts. But I doubt that that's going to happen, because the breast cancer screening industry, like, why would they want to prevent breast cancer diagnoses? They don't. It's a $1 trillion industry. There's nothing in it for them, for us to be healthy. And you can say the same about the cardiovascular industry. I mean, if we took away statins, because most people don't need them, if we took away antihypertensive medications, because most people don't need them, if we took away all of the procedures, where would the system be? And the system is entirely built on people being sick. There's no reward anywhere along the way for people to be healthy. So the only way that the doctor makes money, the only way that the hospital makes money, the only way that anyone makes money is for you to be sick. And so we have a system that's built to make people sick. From the very beginning of don't breastfeed children when formula is every bit as good, right? We get the messages immediately. And I am not kidding, immediately, in that when my best friend, it wasn't a whoops baby, but it's definitely a later in life baby. And when she had her baby and she told them that she was breastfeeding, and they said, your milk isn't in yet, let's just give him a bottle tonight. Now, do you think that God got it wrong?
Absolutely not. No.
If your milk was meant to be in the second that baby came out of the chute, then it would be in the second the baby came out of his chute. But the baby needs to rest and doesn't need to feed right away. And we are designed perfectly. Yeah. And that baby does not need a bottle that night. And yet it starts from the very, very, very beginning. And then it just continues on, right? We're told, start to feed your kids cereal at 6 months or 4 months or whatever it is. And so what do? They start to feed their kids grains. Why? We have absolutely no nutritional need for grains. If we never had another grain again in our lives, we would suffer no nutritional deficiencies.
Correct.
We would probably be better off because we would have less glyphosate and pesticides and all the crap that's on it.
100%. But how else do they deliver the glyphosate and pesticides in you if you're not eating grains? I mean, I know this sounds like so conspiracy theory and like...
Not to us.
Not to us. Not to us.
But it's my truth.
Yeah.
Ours too.
Yeah, it's not conspiracy theories at all to us, but I think what would really get people is, so then as we get older, we start hearing all this, preventative screening. We need to be getting the mammograms and pap smears and colonoscopies.
I've had
happening
people look at
there?
me like I'm crazy that I haven't done a mammogram yet at 41.
Yeah. So I'll say this
Right.
about that. There is not one thing about a mammogram that's preventative. Not one thing. Not one thing. This isn't like me being the cynic. This isn't me being critical. This isn't me trying to push my agenda. I feel like I'm just in this Charlie Kirk space of prove me wrong. Prove me wrong. What is the one thing that is preventative about mammogram? And I'll back off because it doesn't exist. There isn't one thing. Mammogram is maybe early detection, but there is nothing preventative about mammogram at all. And in fact, mammogram, despite the lovely name that we gave it, mammogram, picture of the breast, it is an X-ray. And in every other scenario, if you ask someone, does radiation cause cancer? The answer is a resounding yes. There's no argument. There's no show me the data, right? Radiation causes cancer. Understood, right? It is a known carcinogen. And then you ask, do mammograms cause cancer? Absolutely not.
That type of radiation is it's just
Right.
magical. It doesn't
It's
impact
Jack's
the body.
magic bean radiation, as it turns out, right?
Yeah.
It make sense. Like, it is astounding to me, and yet everyone has seemingly checked their brain at the door, and they're buying this whole narrative, hook, line, and sinker, and it is simply untrue. And and we've known for decades that mammograms don't even save lives. They don't even save lives. They don't
So is it
save
about the
lives.
money?
They don't
Why?
save breasts.
Why?
It's a way to get people in the system. And it's just like giving the bottle. It's just like giving the grains. It's just like giving the vaccines. It's a way to get people into the system and keep them in the system. And we know that a certain percentage of breast cancers are going to be radiation-induced malignancies. They're not all, right? I get people jumping down my throat. I only had one mammogram. Okay. So you had breast cancer that wasn't caused by radiation, but there are plenty that are. Plenty. And if you ask that woman, if a woman really knew and really understood that her breast cancer was due to her getting mammograms every year, do you think she would back up 20 years and say no? Definitely.
I would hope so.
Yeah.
But we're
So-
not
so
given
for
this
our-
information. And instead, we're given this narrative that mammograms save lives. And it's easy and convenient for people to believe that, and so they do.
Sure, convenient. Just for our listeners, because I know you've looked at like the before and afters of, and it's not preventing, and in a lot of cases, the numbers actually show it's causing. Can you just explain a little bit about what you've seen percentage-wise in people who've done them versus not?
So I'll first start by saying that where all the mammographic screening programs came from around the world is based on the original data out of the UK. And a breast surgeon there, Dr. Michael Baum, was endorsing the study that was done in the late 1960s where they took 1,000 women and invited them to have a screening mammogram, and they compared them to 1,000 women in the general population. And when they looked and screened these women over 10 years, they found that if you screen 1,000 women with mammogram, and there were so many flaws in this study, starting with the invitation to screen, because obviously the women who are going to be invited to screen are healthier women, and it wasn't just the invitation to screen that was studied, it was those that accepted the invitation to screen. So really health conscious people are going to accept that. So we're not even comparing equal populations, but beyond that, when you look at 1,000 women and you screen them over 10 years, 4 will die of breast cancer as compared to the general population that doesn't screen. 5 will die of breast cancer. 4 is 20% less than 5. And so the headline was, mammogram reduces the risk of dying of breast cancer by 20%. That's where those numbers came from, and that's what stuck. Now, what they didn't say is that the same exact number of women died of cancer in both groups. So it did not have, there was no survival advantage, and there has never been a study that showed survival advantage by screening with mammogram. And what the study didn't say is that when you screen 1,000 women, at least 100 will get called back for additional views, biopsies, unnecessary procedures. And of that, you will also have somewhere between 20 to 30 women diagnosed with breast cancer who would not have ever developed clinical disease. So overdiagnosis, overtreatment. So no survival advantage, 100 women treated with biopsies and unnecessary procedures, 20 to 30 women overdiagnosed with breast cancer. These numbers don't match up, right? We are hurting way more people than we are helping, way more. So, but in any event, the 20% reduction of death from breast cancer lit the whole world on fire, and everyone started these screening programs. And then in the 1980s, there was the Swedish studies, which is 600,000 women, so now much, much bigger sample size. And in Sweden, they have universal health care. So everyone has the same access to care. Everyone gets the same kind of care. So half of them, they're screening with mammogram. Half of them are just getting physical examination, or they're doing whatever they're doing, right? The same number of women die of breast cancer in both groups. There's no reduction in deaths from breast cancer. And the only difference between the two groups is that when you screen with mammogram, you will diagnose an additional 20 to 30% of these women with breast cancer. 20 to 30%.
Wow.
So let me just give you that number in perspective. We diagnosed 300,000 women in the US last year with breast cancer. That means that 60 to 90,000 women were treated for breast cancer who would have never developed clinical disease. So there was some thinking that maybe the results from that study was because we looked at women all ages, and maybe everyone doesn't benefit from mammogram, but young women surely will benefit from mammogram. So the Canadians did that study, and they looked at women 40 to 59 years old. 90,000 women, 45,000 get screened with mammogram, 45,000 just have physical examination. Again, universal health care. Everyone has the same access to care. Everyone has the same kind of care. The same exact results. The same exact number of women die of breast cancer in both groups. And if you use mammogram to screen, you will overdiagnose somewhere around 25%. So the only reliable data that we have is that there is no reduction in breast cancer deaths. And all that we can consistently say is that using mammogram to screen leads to overdiagnosis. Now,
is the overdiagnosis a false positive, or is it those people are metabolically healthy and will never really have an issue?
I don't know if they're metabolically healthy because I don't know that the study was powered to determine that, but they were age matched, they were matched for comorbidities, they were matched for a lot of things. The reason that you have this overdiagnosis, and we know this from autopsy studies, when you look at women who died of something else, car crashes, suicides, overdoses, when you section the breast, you will find microscopic evidence of breast cancer in 1 in 5 women. In 1 in 5 women, randomly, just random sampling of the room, doesn't matter age, anything like that, 1 in 5 women will have microscopic evidence of breast cancer. 1 in 5 women do not get breast cancer. Nothing like that. Nothing like that. Certainly not 1 in 5 20-year-olds, 30-year-olds, 40-year-olds. Nothing like that, okay? So the truth is that we all make cancer cells, from the very young to the very old, everyone in between, but we don't all develop cancer, right? Our body recognizes those cancer cells in their infancy and either destroys them, or something physiologic changes and it doesn't make more, or the process is arrested. Whatever it is, most people do not go on to develop the clinical disease. But if you use something unsophisticated like mammogram to look for these microscopic changes and you find them, you are going to overdiagnose significantly. And Gilbert Welch wrote a brilliant book called Overdiagnosed in 2014, where he's talking about this issue in breast cancer, but he's also talking about this issue in prostate cancer, in
I've heard that.
Hypertension, in cholesterol, in thyroid cancer. I mean, we're guilty of it across the board because what we have done is we continue to lower the threshold for who gets the diagnosis, so that you can continue to give more and more and more drugs and treatments.
And then you not only have these toxic treatments, but the mindset of I'm sick.
Right. So once you give a woman a diagnosis of breast cancer, you forever change her, and not in a good way. Right? She no longer trusts her body. She's scared. Not to mention all of the actual physical changes that will happen to her, right? She'll have surgery that deforms her or removes her breasts entirely. She'll question her femininity. She'll question her identity. She'll question her sexuality. She'll question her health. And most treatments for breast cancer actually diminish both the quality and quantity of women's lives, because it leads to things like accelerated heart disease, accelerated neurodegenerative disease, accelerated osteoporosis. And lest we forget, the same number of women that die of breast cancer every year die of a complication of a fracture. So in essence, we are in general trading in one diagnosis for another equally or more lethal. And it's not the right thing to do. Now, I do not want to diminish breast cancer. I am not saying that breast cancer isn't real. I'm not saying that breast cancer isn't horrible. I don't think anyone should have to go through a breast cancer diagnosis. However, we are putting people through the rigors of a breast cancer diagnosis unnecessarily, close to a third of the time. This is a problem. This is a real problem.
Yeah. So Dr. Jenn, I have to share, I had a kind of crazy experience with some of this last year. So I found a lump in my right breast, and growing up in a holistic household, I was like, I'm never getting a mammogram. And then I got breast implants in 2016. And I was like, now I'm definitely never getting a mammogram. And so a year ago, I found a lump, and I went to get thermography. And the thermography showed, it's bright red. It's very inflamed. Something's going on. And so I went to my OBGYN here, and she says, we have to do a mammogram and an ultrasound. And I said, can we just do the ultrasound first? Mm-hmm. And nope, insurance will not pay for the ultrasound unless you do it the same day as the mammogram. And my first thought was like, is this about the money, or is it about the diagnoses? I don't know. I was kind of upset about that. So I ended up doing both. And I now have a small rupture in one of my implants, which when you go into the mammogram, they have this beautiful consent form saying all the things and how we could rupture your implants. And you are signing off that if we rupture it, it is not our fault. And then it turned out, so there was something there. I got the biopsy, again, pressured into doing the biopsy, and then it was nothing. I have dense breasts. And but the fear.
Welcome to the breast cancer circuit.
The circuit,
Right.
and the fear-induced circuit. Like, I was out of my normal way of thinking.
Very intentional, unfortunately. I mean, it's sick.
Yeah.
It's sick. So the whole, you can't have an ultrasound without getting a mammogram narrative. Don't you love that?
I'm like, I'll pay for the ultrasound if that's, and now I know I could have gone somewhere else and paid out of pocket, but I didn't know at the time.
Maybe you can go have a HER scan, and there are some places that will do it. You can't have insurance pay for it unless you agree to their mammogram. And again, This is my very, very, very cynical side. So it does have to do with insurance reimbursement, because insurance literally will not pay for an ultrasound without a mammogram. And the reason is that, first of all, if nothing is seen on the mammogram, they want to be able to say your ultrasound is not covered because it's not indicated, right? So that's their way of getting out of paying for an ultrasound. The other thing is, people often say it's awful. It's awful. And there are some radiologists that simply won't read your ultrasound unless you've had a mammogram, because they say, like, oh, they won't put their license at risk, and it's not standard of care, and blah, 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 blah. Because there are things that a mammogram will see that an ultrasound will not. And this is why I have a waiver living on my website that says, I understand that there are things that a mammogram will see that an ultrasound will not. And I am not holding you accountable to those. I don't want to have a mammogram. And so I accept responsibility for the information that might be missed. And I am only looking for the information that can be provided by my ultrasound. Please give me my ultrasound. That said, the insurance companies, so many people say, well, this is all my insurance will pay for. And they think in their head that somehow that makes it the right thing to do, right? We have to remember what insurance companies are. They are. That's an industry that is built on them making money, right? And so their goal every single year, and it renews every year because every year their patient population is different, right? So all they're thinking is, how do we get through this year with you, spending the least amount of money, because next year you may not be our client. And so I'm not worried about what happens to you next year. So if I deny or allow for whatever procedure and it has ramifications down the road, I don't care, because the likelihood is you're not going to be my customer then. And so the insurance industry is all about kicking the can. Kicking the can, kicking the can, kicking the can. So they are only concerned with minimizing their spend on you this year, because next year it's unlikely you will be their problem. And so when people think that what is approved by insurance or allowed by insurance or any of that is what's good for them, they've been completely brainwashed. Now, please know, I am not meaning to attack insurance companies or insurance company owners or what they make or that fucking lunatic that murdered someone. I mean, that is horrible and unacceptable. But you have to see insurance companies for what they are. They are a business. They are not in the business of protecting your health. You have to protect your health. They are not in the business of protecting your health. They are not on your side. They are not on your team. They don't give a shit about you. They are in the business of making money, and that is what they are going to do.
Yeah, absolutely.
It's the sad truth, but yeah.
So if we have to be our own advocates, we
Yes.
do.
Yes.
What's the next step? What screenings can we do? I know there's like an eye test. We have your imaging.
Yeah, so, I think even 5 years ago, there weren't options. And so to go out and say, don't use mammogram to screen, it doesn't save lives, it doesn't save breasts, that was heresy. Because women felt like, well, but that's all we have.
Sure.
Right?
Right.
That is no longer true. And so for all the people that want to jump down my throat and say, how can I come out against this proven test that's been used for 50 years? Well, it's only been used for 50 years because we haven't had alternatives. But we need to stop putting that lipstick on that pig. That pig is done. Put that pig out to pasture. Okay? So what everyone should be doing for screening, everyone should be examining their breasts. No one is going to know you better than you know yourself. I know that's not preventative. I know it's still on the detection side, but everyone should be examining their breasts. The second thing that everyone should be doing is the Auria tears test. So have you guys heard of this test?
Yes. I
Speak about it. Yeah.
I haven't done
I have
it.
a very crumpled box from my test that I have kept to show people. So this is a test that it's an at-home screening tool. It is extremely affordable and it takes 5 minutes. You can do it in any state in the country except for New York, which New York really needs to be annexed at this point.
I know. You can't order anything.
Anything.
It's crazy.
It's horrible. It's horrible. But if you're in New York and you come to my center, Perfection Imaging, to be screened, we can run your test while you're there. Again, 5-minute test. It's a little litmus paper that goes in the eye, and it measures 2 proteins, the S100A8 and S100A9 proteins. Now, these proteins, when they are both elevated to critical levels, are highly, highly predictive of early breast cancer. Like 93% sensitivity, which is better than, way better than mammogram, better than ultrasound, even better than QT, which is the imaging that I advocate for, because QT has a 91% sensitivity. The only thing that it's not better in terms of sensitivity is MRI. But MRI has so many false positives, plus it uses gadolinium. So I don't use MRI for screening, but I use Auria on everyone. Because if you have a negative Auria test and a normal breast exam, you're done. You've done your breast cancer screening, and you just repeat your Auria every year. If you have a clinically positive Auria, this means that you do have those inflammatory proteins, and you are at risk for breast cancer. And you can read my book, The Smart Woman's Guide to Breast Cancer. You can work with someone to figure out where your inflammation is coming from and work to lower that inflammation. You can take my prevention course, but what you have is you have opportunity. Now, anyone who has a clinically positive Auria test needs imaging. So the imaging I advocate for is QT, which is what we do at Perfection Imaging. This uses sound waves to create a true 3D reconstruction of the breast. So unlike the ultrasound that people are used to, this is much higher resolution, much higher sensitivity, a true 3D reconstruction of the breast without pain, without compression, without radiation. So 100% safe, and no one ever gets hurt by doing this kind of imaging. Because when we are talking about the screening population, we are talking about healthy women who have no reason to believe that they have breast cancer. It is unethical to put these women in harm's way. It is unethical to expose them to radiation. It is unethical to expose them to gadolinium, which is what is used with an MRI. And I think that it is unreasonable to do any of those things now that we have technologies readily available. So if you have an at-home screening tool, the Auria test, if you have an at-home screening tool that takes 5 minutes and is totally affordable, why would you go get a mammogram? It doesn't make any sense. Makes a lot of dollars, but it doesn't make any sense. So
Yeah.
that's
And where
how I screen for breast cancer, self-breast examination, the Auria tears test, and if that test is positive, either having a QT or an ultrasound. Now, if nothing shows up on the QT or ultrasound, then you have that opportunity to actually prevent a diagnosis. Because we know that you're at risk, we know the inflammation is there, but you have not developed clinical disease. You have opportunity. And that is real prevention. So this is the only screening that is about prevention. And that's why I am so excited about it and such an advocate.
Yeah, that's amazing. So easy to do. And with the imaging, so how many locations are there now in the US?
So there are about 7 locations in the U.S. I have one in the suburbs of Philadelphia, but I'm in the process of opening 50. And
Amazing.
so I do have an ask of your audience, and that's that I need more readers. That is what is holding me back from expanding. So if you are a radiologist with breast training, I know it's hard to hear, and I don't need you to say anything about mammograms. I don't need you to abandon your past or abandon your training. Like, it's all water under the bridge. But come help the future. Come be a part of this movement, this momentum towards safety and transparency and doing the right thing for people. Because I'm not looking to create more customers. I think our medical system is busy enough and will continue to be busy enough without us contributing to more disease. So come work for me.
Yeah, what a great opportunity. Yes.
Absolutely.
Yeah.
Yeah, we definitely want to share that with as many people as we can. So valuable.
Yeah.
What do we know?
Just one final question about screening. Any thoughts on the Gallery test?
So this is one of those circulating tumor cell tests that can identify a number of different cancers, presumably in their infancy. I think that we're not there enough in terms of our prevention models. I don't know that there's enough support for that test as yet. You know, when I talked about the Auria test and what to do if you have a clinically positive result, I have a very clear map of what people can do with a clinically positive result. I don't think that exists yet for the Gallery. And so I worry about what to do with these findings. Like, yes, we can image the whole body, but you have to remember that once it's visible on imaging, we're talking about like billions of cells, right?
Right.
So it's not exactly early once it's visible on imaging. And what do you do in the in-between? What do you do with the positive galleries with negative imaging? And until we have a clear sense of that, I mean, of course, I know what to do. I'm going to take that person and figure out where the inflammation is coming from and optimize their health. But most doctors have no idea what to do with that. And so I think that we need to create more protocols around health before we roll that out to the general population. Also, that test is an expensive test.
Yeah. Would you say the same for Pronuvo? And then I'm curious where you think thermography falls on that path.
Again, all of these are where the integrative medicine world, functional medicine world, whatever you want to call us, get the accusation of, oh, it's medicine for the rich, right? Because how many people can really afford the $3,600 Pronuvo test, which is a whole body MRI? And they have a competitor now. I can't remember. Do you remember the name of the?
Ezra?
I don't know.
I think it is. I keep getting ads on Instagram for it. It's cheaper than Pronuvo.
Yeah. So I think the other one is coming in around $2,500 for the whole body MRI. And
Pronuvo is 25.
Oh, I thought it was more than that.
There's a step up where you can add blood work.
Yeah.
Which is crazy. Blood work shouldn't cost that much, but
yeah. So, but again, how many people have $2,500 to even put towards this?
yeah.
Now, if we really had proper health savings accounts rather than paying for insurance that most of us will never use or need, then it would be a different story, and tests like this would be far more accessible for people. I mean, that same $2,500 that they would use to scan themselves from head to toe is maybe 1 month's worth of health insurance. Like, health insurance is very, very expensive.
Yeah.
Yeah.
So, in any event, those tests can, in some instances, find things early, like pancreatic cancer, maybe that is asymptomatic, and that does change outcomes for people. There are some cancers where early diagnosis makes a big difference. It doesn't happen to be true in breast cancer, but there are some cancers where early diagnosis makes a big difference. And just to give some support behind that breast cancer comment that I made, no matter how many mammograms we do every year, the same number of women die of breast cancer. And this has been true for decades. No matter how many mammograms we do every year, the same number of women present with advanced disease. So we are not influencing the bottom line. And all we're doing is diagnosing more women with cancer that they probably would never have known about it in their life had we not used these methodologies. But in any event, you know, I do think that there is some value and merit to whole body scanning, just knowing that it's not prevention, right? It's early diagnosis, potentially early diagnosis. And I think in many ways, we have to come up with a standard of what we're doing with the information.
Yeah.
And until we do that, I'm not sure of its value. I mean, this is my biggest objection to the Gallery test is what are we doing with the results? Because I think most people don't know what to do with those results.
Yeah.
Most practitioners do not know what to do with those results.
Mm-hmm. Yeah. I mean, what's the sense in collecting more data and things if you can't make a change and don't know what change to make? It's a waste of time and money.
Yes.
So, okay. Well, great.
Yes.
Thank you for breaking that down. And all the different testing. It's so interesting. I mean, fortunately, we are in a much better place than, like you said, 5 years ago. Like we have more options. It's great.
And I'm very encouraged that it's going to get better and better.
Yeah.
But we need to infiltrate the mainstream.
Yeah.
And we're going back to the change thing, right? It's very, very hard. And right now, our medical education is essentially being controlled by the pharmaceutical companies. And until we break away from that and have an independent training system, I'm afraid that change is not going to come anytime soon.
Yeah, sadly.
So for me, what I see the greatest impact coming from are young people like you who are health aware, and your colleagues are health aware, and we're not trusting the narrative that's been told to us, and we're being logical and using our brains and knowing like that couldn't possibly be true, and thinking for ourselves and demanding better. I know, at least in the imaging realm of things, the women that come to Perfection Imaging for their QT scan, for the Auria test, for an evaluation for hormones, even the breast cancer population, these women have all heard the narrative. They've just said, there's no way it's true, and it's unacceptable to me, and I'm going to go outside of the system because it's the right thing to do for me. And this shouldn't be outside of the system. I mean, every single day I get messaged on Instagram and Facebook, why isn't this covered by insurance? Why isn't this available to everyone? Well, you should be asking that question. You should be asking that question. And conversely, you should be asking, why are you forcing me to have a mammogram? Right? I don't want to have a mammogram. What happened to my body, my choice?
Great question.
So I think that the change is going to be on the backs of the people, specifically the women, that demand it. That's where the change is going to come from. It's not going to come from the system. The system is comfortable and happy. They're the fat cat lapping up the bowl of milk.
Oh gosh. Yeah.
It's shitty.
Yeah.
But you're right.
But that's what it is.
Yeah.
And, doctors aren't going to go out on a limb. They're working as hard as they can work. Some of these doctors are forced to see like 30, 40, 50 people in a day. Their heads are spinning. They're not going to take on the system. They can barely keep it together.
Sure.
Right.
So that's not where the change is going to come from.
Mm-hmm. Yeah.
I mean, I have colleagues that, they're mammographers. They're reading 150 studies a day. Like, where is their time to fight the man or even think about whether the system is broken? They don't have the time, the bandwidth, the capacity.
No.
Yeah.
It's a very broken system.
Yeah. Well, for those listening, please share this episode with at least one friend or family member. That's my ask of you today. Because I think the more we can educate, the more people know what questions to ask. We can demand it, and I think it will change. So, Dr. Jenn, where can people find more about you, to learn more about the imaging, the work you're doing, maybe come see you? And we can link to that in the show notes.
So, first of all, if you want an Auria test, you don't have to come see me. Just go to Auria, AURIA.care, and put in the code DrJenn20, DrJenn20, and you'll get 20% off of the test. So,
awesome.
If you want to follow me, it's Dr. Jenn Simmons, and my Jen has 2 N's, and that's on all the social outlets. I have my own podcast. It's called Keeping Abreast with Dr. Jenn, so you can listen to that. And then my website for my medical practice is realhealthmd.com. And if you're interested in coming to see us at Perfection, it's Perfection Imaging, and Perfection is spelled with a QT in the middle. And there we're doing the QT imaging, and we're also evaluating women for their hormonal health and helping them and supporting them, including those at high risk or those with a history of breast cancer, because those women deserve the same love and attention that everyone else is getting.
Amazing.
Thank you for everything that you do. So happy to be connected with you, and thank you for coming on our show. Can you share maybe one final piece of advice, something our audience can start doing today to optimize their health?
Absolutely. Well, I think what we started to talk about before we got on the air is that breast health is health. And the same exact things that you're going to do to have healthy breasts are going to give you a healthy brain and a healthy heart and healthy skin and healthy bones and healthy mood and healthy libido, all of it, right? And so I think that it's just pretty simple. Eating whole foods and moving your body and prioritizing sleep and drinking clean water and avoiding as many toxins as you can. Just simplify your life in as much as you can. But the thing that we don't want to do is farm out our health to anyone else, because health doesn't happen in a doctor's office, and it doesn't happen in a hospital or a chemo suite or a radiation suite or anywhere. Health happens at home with the things that you do every day, and the only person that can make you healthy is you.
Mm-hmm. So well said.
Thank you so much, Dr. Jenn.
My pleasure. Thanks for having me.
And thanks to everyone that tuned in today. We will see you next time.